Thank you. Senator Cassidy?
Yes, thank you. Although we have a little extra time, I am got a lot of questions, so I'll ask you all to be tight with your questions. First, Mr. Fain, I totally agree with you. My practice as a physician was in a hospital for the uninsured. Folks want jobs and they want decent pay. I agree with that entirely. There's a little bit of kind of, though, confusion in what we're saying. I just want to put out some of that confusion. When you say people are working longer to make more money, well, if you just cut them down to 32 hours a week, they're still making the same money. So for them to grow their income, they would have to either work overtime and or take a second job. And yes, there's companies that work 24/7, but the people don't work 24/7. They work 40 hours a week, or apparently on average 41.3 hours per week. So I think we have to be kind of clear on that. And lastly, of course, productivity is not more hours to make the same money. Productivity is more work per hour. And it's oftentimes aided by machines, in which case there's less wear and tear on the body. Not to say that there's not wear and tear on the body. We think of construction workers, but still, that's the whole point. So, Dr. Schor, when you mentioned that decreasing hours worked per week increases productivity, it makes total sense to me. When I go to Spain and go to McDonald's, they don't have somebody at the front desk to take my order for a hamburger. They've got a machine that I push a button on and it dispenses it. And our Department of Labor has said that if we raise minimum wage, there'll be a net loss of jobs because people automate in order to decrease their labor cost. So how would, if you're speaking of a service industry, why would raising their labor costs by having fewer hours worked per week for the same salary be any different than raising the minimum wage in terms of an incentive for a net loss of jobs by replacing workers with automation?
Yeah, thank you for that question. Let me just respond.
Real quick.
Yeah, 2 points. One is we're seeing no increase in overtime, in second job holding in our studies, by the way. But the impacts that we're seeing here are not labor displacing because people are able to make up that productivity in the 4 days that they had in the 5 days. Yes.
That surprises me because I just intuitively, I'm a doctor, so intuitively when I read about the Temple nurses working shorter hours, I'll just say that according to the Pennsylvania Hospital Association, 30% of RN positions are unfilled. And apparently Temple University Hospital spent $55 million for nurse overtime because of a nursing shortage. So yeah. I'm not sure how to square that because they worked less hours, but they had to pay more for overtime and or for others.
These are for their nurse managers because the other nurses are on these like 3-day schedules and so forth. So, and this was put into place at 2 years after the pandemic started.
So the nurse managers are working less, not the RNs themselves.
Correct.
Okay. Well,
so they haven't, because they're not on 5-day schedules, so they haven't.
I'm almost out of time. I'm going to move. Mr. Leland, right now we're trying to get a health bill. The best I can tell, my staff is working 80 hours a week. Because anytime they call me on a Saturday or a Sunday or a Monday on a holiday, they're fully prepared and obviously there. When y'all got a big crunch time, deadline has to hit, boom, you got to move. Like people still only work 32 hours?
No, it's a norm, right? This is not pencils down at 32 hours. It is the question of, well, what is your standard work week that you're flexing
Got it.
around?
That's all I was going to check. Dr. Vittert, I look at France's unemployment rate among the youth. It's like 17%. It's pretty amazing. And then for the next group, it's like 7 or 8%, much higher than ours. And you had mentioned, and they've got other labor laws as well, but you had mentioned that this kind of, sugar high of more satisfaction, but then it evades and then it goes away, but also that there's a loss of work as workers either go to temporary workers or offshore. Could you elaborate on that, please?
I think it's the same kind of idea as right when COVID hit, we're all baking bread or doing whatever we're doing, and then as COVID went on longer and you're at home more, you're sitting in your bed longer. It shows in the long-term studies that things just go back to normal. We just see that happen all over again with people. And I think we see it clearly in terms of unemployment rates in the same way.
So if you will, the other things that occur, the disruption in the economy, et cetera, really have more to dictate your happiness than whether or not you work a little less. Indeed, there may be a loss of a job because of this impact upon you.
And that's exactly what happened in France, as people lost their jobs.
Gotcha. And Mr. King, just to make the point, there is nothing to prevent a business like Mr. Leland or Temple University Hospital for a select group of employees to have a policy which would be 32 hours a week. So there's no reason for a mandate per se. Companies can do that, just to make that point.
Yeah, absolutely, Senator. And that's the point. Let's give flexibility to workers and to employers. Don't have government come in and intervene. It's going directly in the opposite position of where we should be going. Now, as far as the number of workers available in this country, I agree with Mr. Fain. We need to get more people back into the workforce, for sure. But study after study shows, even if we did that, and I'm looking at a recent U.S. Chamber of Commerce study, we'd still have 3 million jobs open in this country. This proposal is going in the wrong direction. Flexibility is what we need.
And Dr. Vittert, Dr. Schor, first, I'm going to ask you this, then go back to Dr. Vittert. You had mentioned, I didn't quite get the association versus causation. You say that when there's more inequality, that people work longer hours. I didn't quite understand that relationship. Is that an association or a causation?
These are done with macroeconomic studies, so we believe they're causation, but they're not controlled experiments, and that's...
Dr. Vittert, any comment?
If you don't have a controlled experiment, you cannot find causation. It's just statistics.
Yeah, I once gave a vaccine to a person who became pregnant, and it made me realize that, just because it happens at the same time, it's not a causation, it is an association.
Yes, but these are highly sophisticated studies, and I really would disagree with the idea that we can only know something if we have an experiment.
Yeah, but I don't understand intuitively why it would happen, but I'm out of time.
Oh,
yeah.
Because people need to work more hours to keep up, because there's a comparative dimension to the way people's sense of what is
I'm not sure
adequate
that
is.
the thing of milk costs more because somebody else is making more, but that's another story. Yes.
Senator Hickelman.